there are surgical treatment options known as deep brain stimulation, which we are routinely doing in immense, and also cheaper treatments like thalamotomy, pallidotomy. So a patient who has a very, very severe shaking of the hand can benefit by one side thalamotomy. Now, who needs surgery, who needs treatment, that the movement disorder specialists need to decide. So I'll show you some examples. This is the patient of Parkinson's disease. This is the first patient which I showed as such is severe slowness, bradykinesia, gait. You saw this was before deep brain stimulation and before the medicines, before he took levodopa, carbidopa. But these patients of Parkinson's disease, after they start taking levodopa, carbidopa or medicines, they develop abnormal movement, what is known as dyskinesia, because of the over side effects of the medicine. So this is the video which you're seeing after the deep brain stimulation. Such a significant improvement. So what I was telling is that patients of Parkinson's disease in the first 5 years or so can be treated adequately with medications which is available, but after some time they develop medicine related side effects like dyskinesias, and at that point of time it is very important that we consider these surgeries which will reduce the dose of these medications and thereby reduce the over hyperkinetic, the dyskinetic movements in these patients. The patient where patient came with very, very severe shaking of the hands or tremor and very minimal slowness, and so these type of shakings are very refractory to most of the medicines which you use orally. But this gentleman, we did a deep brain stimulation and see after the deep brain stimulation significant improvement. Now I just want to tell you what is deep brain stimulation. So deep brain stimulation is where we put a small pacemaker in the outside in front of our chest, and wires are put inside the head and two areas of the head. Those are known as subthalamus or globus pallidus internus. Now this operation is done usually when the patient is awake, and after the operation is done, we do the programming of this battery from outside. So this is known as deep brain stimulation. So we stimulate the deep nuclei in the brain. So this gives a very good improvement of in patients with Parkinson's disease and some of the patients with tremor and dystonia. It is relatively costly, and but in immense with because it is a government hospital, the patients get definitely a significant less cost compared to the other hospitals. But many of the patients cannot afford deep brain stimulation. So in those patients, we offer what is known as listening operations, and this is an example of a patient you can see here. So this is a patient actually of a Wilson's disease, very treatable condition, but nonetheless she had very, very severe tremor. She was not able to hold the cup, and this is after doing listening. The left side of the brain, listening was done, and it controlled the tremor of the right side. So this, the patient just spends only a few thousands of rupees, and it's quite cheap, and this treatment can be offered to selected patients. So although these treatments are not curative, as I told you, they can significantly improve the quality of life